Hello, everyone. Welcome to another episode of The Different News. Well, we have heard this term soft skills quite often, and we hear, that's a world today we live in. Everybody talks about how to improve the way we speak or how we behave. But the point is, how do we understand what to improve? That's the big question. Well, as you can see, I have my gorgeous guest with me in today's episode, Rashmirekha Sarma, co-founder of Beyond Gurkul. Welcome, Rashmi, and it's a pleasure for me to host you on my podcast. And thank you so much for accepting my invite and being on my show.
Thank you so much, Gargi. It's a pleasure to be part of your show. A big fan of your work. Thank you so much for having me here.
Thank you, Rashmi. I think I have a lot of questions to ask you because, of course, soft skills is something that we have been listening and coming from a healthcare or medical background. I think we need a lot of training because we are kind of technical guys, as our courses actually don't help us to learn those things much during our curriculum. Honestly, that's a bold fact and truth. I might get trolled for this, but okay, that's how my different news is. So I think I have a lot of questions to ask you because I really want to learn, and also I think my audience will be having a good time understanding from an expert like you. But before that, my favorite question to all my guests is understanding your journey, what you have been doing, and how you landed up on Beyond Gurukul. So that would be interesting.
Sure. So, Beyond Gurukul actually started from a very personal space for both Hina, who is my co founder, and I. We come from long corporate backgrounds, and we worked with stalwarts, multinational companies. We have gone through a lot of our own share of challenges, mistakes, learnings. And over a period of time, after working for many years with different people, teams, sectors, we realized something very important. People don't really struggle because they don't have knowledge. They usually struggle because they don't fully understand themselves, how they think, what their capabilities are, how they respond, communicate, and how they make decisions. So in September 2021, during COVID period, is when we started Beyond Gurukul with a simple intention to help individual understand themselves better, so that they can perform better in their roles, in their careers, in their life, using their strengths. Working on areas where they really need extra assistance. Right? It's not necessary that you need to go all the way, but you may need extra help, hand holding. So that's where it comes in. Our work spreads across three different areas. One is career counseling for students and professionals. Second is profile building and guidance related to the career paths they choose. And third is power skills or soft skills for any sector. So that's what we do. And you rightly said, healthcare is one of our, area of interest where we have been working.
So thank you, Rashmi, for sharing your journey. I'm sure it's a fantastic thing, and I'm sure you have faced a lot of challenges as well. I mean, that's what comes with any entrepreneur that way. Like, for example, I'll talk about my field, healthcare. So what happens with us is like the way we are trained through our curriculum. So we tend to acquire certain skills. Our focus goes more on the technical aspect. Now, again, I have myself attended quite a few of soft skills, typical soft skills training. Here, I'm not to dishonor anybody, but the problem is uh, doesn't align. Many of the things that I couldn't align with the stuff that was told to do or perform. Um, so, uh, so I am just curious that is there something that you do different, which could help individual, particularly today we are focusing on the healthcare community. So, is there something different that you have where somebody can, a doctor can understand, or a student as a student also they can understand where exactly would be my, where I should improve, because I think for us the profession we are into, it's very people centric.
Yes.
So it's very different from when we are into an IT company or we are in a big corporate setup, or because we work closely with people. So for us, the soft skills would be kind of, I feel, customized. Please correct if I'm wrong. So if I could know where actually my weaknesses lies, or maybe my strengths as well, which I'm not aware of, that makes me more powerful in terms of improving myself, and also like delivering whatever I want to do to my patients, and the way I talk to them and stuff like that, or even people's management. So
Yes.
I think that is something which I'm very curious to learn from you. Is there something that you do differently?
Yes, absolutely, Gargi. Thank you for asking that question. So, what we bring to the table is a competency and behavioral assessment. It's a scientifically designed NLP based assessment which is patented by Government of India, and we use that as a starting point for every almost every individual and organization. It helps us to understand, it basically gives a clear picture to the people taking the assessment about their strengths, their blind spots, how they communicate, how do they think under pressure, how do they learn, and what is the best way they usually respond to people, how do they deal with stress, and what are certain specific areas they need to develop. For example, I can't tell someone that you need to develop your delegation, art of delegation or delegation skill. I need to tell you what exactly do you need to do. And this assessment gives us that opportunity or tool which can be used as a blueprint for who you are and how you can work on areas where you need help.
I think that sounds very interesting to me. And I think I have a kind of question for you coming in. So I'll throw you that in a while. Okay, Rashmi, you thought about this assessment. So it sounds very interesting to me. So, would you like to highlight or tell me that whether there is a structured approach in this, and like how does this assessment specifically could be applied to medical and healthcare professionals?
Sure. So this is an online 60-minute assessment, right? And the person who is taking the assessment, they find the questions really easy and very straightforward, simple situational questions. But the background algorithm, the background work that happens, lets us get a very detailed insight into what the assessment really is. So we have started applying this assessment across multiple domains, right? And one thing that we have noticed is that behavioral side is even more critical for healthcare patients, I mean, healthcare professionals, because
Absolutely.
they work in the area of facing patients. They're always in a sensitive zone. So, behavior and soft skills aren't something which is optional in healthcare. For example, how does a nurse listen? You know,
Mm,
how does a
mm,
doctor communicate? How a team together handles stress?
mm.
How are decisions made under pressure? In an ICU, how conflicts are managed. There are multiple aspects which come into picture.
Amazing.
Empathy, patient facing staff, how are they behaving in such scenarios? So, our assessment gives healthcare students, professionals, or institutions a very clear map of how one is behaving, what are the gaps that are existing, and based on the gap, we customize soft skills training for doctors, nurses, medical students, even management and support teams. So, the combination of assessment plus curated training is what gives us the edge, and it can be utilized across multiple domains. Like, it's not necessary only in a hospital, it can be in a college, it can be a nursing college where you start from scratch. When they're starting their academics, you parallelly train them in soft skills.
Absolutely. I think that's very important, because what happens is when, particularly in our field, we are so focused on the subject matter,
Yeah.
and like first couple of years would be like only get into the core subjects, blah blah blah. Then starts the journey with when we get hold of the first patient. We are so excited, but it's a very difficult thing as a student, I'm telling you,
Yes.
because
Yes.
well, I mean, I don't segregate or categorize any the healthcare arena like that, but I definitely tell you about dentistry a bit, because I think what you're doing is fantastic. And I think at the student level, it should start, because for dentists, what happens is uh, uh, we straight away get inside the mouth of a person.
Yeah.
I mean, we have to start there. That's our job. And just think, when we are doing it for the first time, and even convincing, you forget. Handling the patient anxiety becomes a huge task. So we should
Yes.
know how to empathize, and we are not taught that. We are not
Absolutely.
taught that. So I
Yes.
think I will love to know more about your assessment in a while, because I think it's a very important aspect. I mean, of course, for anybody, for any healthcare professional, even at the like mature stage, it will be needed. But I think for students, it is extremely important. And I hope through these podcasts, if any of the uh, decision maker authorities of the dental and medical fraternities listening to us today, so I think, sir, ma'am, you need to just jot down about Beyond Gurukul. We are talking more, and it's a request, because I think we see students coming out all the time, but in our profession, it's all about trust, and trust can come only through perfect way of communication. So I think your
Absolutely.
test, your assessment is a good thing. So I'll ask you more about that. I hope you don't mind.
Of course. Looking forward.
Okay, so I understood the concept of your assessment. Is it possible for you to tell something more about the assessment, probably in a more
Sure.
simple language? Because honestly, we don't understand the technicalities behind algorithm and stuff. So we are
Yeah.
more biology persons. But anyway, if you can explain about the assessment in a more simple terms, it will be
Sure.
really nice. Yeah.
So, the assessment that you take, answering those simple questions, helps you have a very, very clear picture about yourself, right? Tells about the test takers' thinking patterns, behavior patterns, decision making tendencies, how do you emotionally respond, what are your strengths, your areas of development, what is your leadership style, what is the left right brain orientation, where do you stand, your learning preference, are you a visual learner, are you a auditory learner, are you a kinesthetic learner, the VAK, right, the communication
Mhm.
tendencies, teamwork patterns. So if I want to give you an example, competencies examples would be listening, planning, your accountability, how do you manage conflicts, people orientation. Behavior tendencies would be, are you impatient? Are you proactive? How much risk are you willing to take? Are you detail focused? Are you people focused, etc.? Response pattern is, how do you react? Do you react versus response in stress situation? How do you
Amazing.
keep ambiguity? How's your teamwork? Concerns
Mhm.
would be, patterns that may affect your performance, and clearly helps you understand what are the areas where you need training or help. It could be something that you need a classroom session, it could be something you learn by your own. It
Right.
also lets you know what degree of training do you need. And there are areas which are identified. It may be highlighted as mandatory training, or it may
Okay.
be highlighted as good to have, which will complement your existing strengths. So that helps us carve a soft skill roadmap for you. It's not something set on stone. A year down the lane, when you implement the suggestion which is thrown by the assessment, you will see yourself improve automatically. There will be changes. In fact, we have taken assessment within 6 months for one individual, and areas have already shown quite a lot of because of the intricate level of suggestion it can give you. That plays a very, very important role. Basically, every single line in the report becomes like a door for development, and you can use it
Absolutely.
as a tool for yourself.
I think that's fascinating because I think that means you are telling, if I'm not wrong, that this is kind of very customizable for the
Yes,
person who is taking the test, right? I
yes.
mean, so you are talking about a report. So can you tell me, like, how is that format of the report, and is it like self-explanatory, or somebody from your team also helps to understand or decipher the information that comes through the report? How about that?
So the report is quite self-explanatory. However, we do have team of people who can help you go through it, understand how exactly you read it. Because as a first timer, it can come. It has a lot of graphical representation to tell you where you stand, and then it further elaborates about where what you need to do, what are your very goods, what are your strengths, what are the areas where you need to focus on, etc. And it is, you're right, it is customizable. Every role requires a different set of competencies, behaviors. Some might be overlapping. For example, even in medical field, right? You, if you
Hmm.
want to do a 360-degree assessment on a particular profile for doctor, for nurses, for paramedics, it will be different. For
Absolutely.
administrative staff, it will be different. So we can't have a blanket assessment for everyone. So we have categorized them under different roles. And
Okay.
for healthcare, it can be customized for the different roles each individual is playing.
I think this is amazing. I think
Like,
I have to take this test on a public forum. I need to confirm you that. Please count
you're
me in as
most welcome. You're most welcome.
and well, after the report comes in, you might have a nightmare because I am a person. I ask too many questions, so you just have to
Excellent.
handle.
That's what gets us thinking as well. So amazing.
Okay, okay, Rashmi. Thank you for giving all that complicated and complex thing in a very simple, understandable way. Thank you so much for answering that question.
You're welcome. So if I
So yeah, Rashmi, the thing is that I understood about the test, the kind of detailed report you are telling. I mean, you will be giving, but you also mentioned that you help people to get trained in the specific areas where they need to be. So how does Beyond Gurkul help or deliver training after the assessment? How is that? I mean, would you
sure.
like to tell us more about it?
Definitely. So that is one of our powerful element that we utilize the assessment to first identify what are the training needs so that we can curate customized training program for each domain. For example, for doctors separate, nurses separate, management, support staff, it's different, patient centric, administrative staff can be different. For example, if we identify that the nursing students need more help in active listening, communication, empathy, it can be curated as per their requirement. Now,
Okay.
student versus working nurses also probably can be addressed differently because they're
Right.
already facing and their requirement will be slightly different from someone who's just starting a nursing course,
Hmm.
right?
Right.
What our strength lies is if a group of students need listening, active listening, we can conduct listening labs. Somebody is low on critical thinking, we conduct workshops on critical reasoning.
Hmm.
How do you think? How do you train your mind to think critically? Low accountability, ownership, responsibility workshops. So our strength lies in curating the programs in such a way that it is applicable instantly for the practicing role, right? So it has to be something which you're taking away and implementing, and we then do a tangible measure whether it has enhanced over a period of time or not. Of course, overnight it is not possible, but the programs are designed to do hand holding. We usually, what we do is we, after we deliver the workshop, we keep an online session where they can come and ask us questions if the session wasn't sufficient or they have, they need clarity. Share their examples because what happens is When we are attending a session within a group of people, there are some people who are going to voice it out. There would be some who hold it back, or they want to apply and see. So we provide that forum where they can come back and share their experience, what worked, what didn't work, what we need to double click and see we can approach differently. And today's day and era, Gargi, what is learned is you cannot put somebody through a classroom session anymore and expect them to learn from it. There are different type of we are our assessment itself is telling VAK, visual, audio, kinesthetic. So we have to consider all aspect of the learners. So it's not only just it probably 20% a slide, but rest of it is usually role plays or activities or case studies which they're doing from their field. And if we so healthcare is one of our areas where we work in different sectors as well. For each sector we do this homework to ensure that it is customized and they can relate very well to the assessments, the trainings, the sessions that are happening, the workshops. So we offer both offline, online, hybrid model of workshop depending on a client's requirement, and the sessions are scheduled based on our clients' availability. Usually, in a hospital or a medical college or a nursing college scenario, it depends on how they can help us schedule. So, it continuous development program based on our clients' need. So, the tool helps us quite a lot, and our biggest strength becomes a precision. We know that exactly what needs to be addressed, not just a generic soft skill program, and that becomes extremely effective, time efficient as well, and then we can measure the progress. That's what we are happy about.
Amazing, amazing, Rashmi. You're doing a fantastic job, I must say. And I love the thing that the part of customization, because that is where I think I call this era not a pandemic, but an infodemic. So much of
Yes.
information. I mean,
Yes.
you just open a website and you have thousands of courses now. As a student or anybody, not only student, I mean, we are all lifelong learners. Whenever we want to learn something, we have too many options to choose. That is a big problem. Yeah,
It
that's a very
is.
big problem. Yeah. So, like you said about the training, I'm just extending my question if that's okay to
Sure,
you.
sure.
Um, you said you have offline, online, and hybrid models, right? So, and you also mentioned that it is depending on your client's requirement. So, is it like group sessions, or it is, or you also do like in-person one-to-one sessions? How is your, how is that formatted? If you would like to share about it.
Sure. So we do both. We do one to one as well. It becomes a personalized guidance session for individual. So we have people coming to us, who are very curious about who they are. They want to learn about these trends, or they want to pivot in their career, or they feel they are stuck and they want some assistance. And so we have a lot of B2C individuals who come, clients who come to us. And true to our name, we definitely go above and beyond in what we provide. So these are online sessions, what happens one to one, and we do it. Video is mandatory for us, so we have video sessions with them, and the assessments happen online, the report walkthrough happen online, the whole program drafting, and that too, though we have a certain packages which they can avail for B2C, but it is purely customizable depending on what extent our client needs help. Not everybody needs a long hand holding. Some might need beyond what we are offering right now. So we definitely customize that. For organizations, it depends on how they want it approached. So one thing that we emphasize is we normally don't want, when we're doing a group, to be not more than 25,
Okay,
because
that's excellent. Yeah.
yeah.
Hmm.
So 25 is also a larger number, but if we reduce it further, people don't want to listen to us. It's too little.
Yeah.
Fewer people becomes difficult for them to schedule, but 25 is a good number because we can then pay individual attention. Though it is a group
Absolutely.
session, it's easy for us to relate one to one with the attendees. It's
Right.
only fair for them to get equal amount of attention. We need to
Hmm.
ensure that they're interacting, their doubts are cleared, and we are able to understand their whole mindset, their behavior within the session, and we are trained to do that. So even if you give us limited time,
Hmm.
90 minutes or 120 minutes, whatever session time we break our modules into, it gives us that ability to connect on the very first session because we are trained to do so. So hence
Absolutely.
we emphasize that make it a small batch size, and we will do wonders for your attendees. And that's our
Absolutely.
strength. We definitely are very proud of how we execute a session.
Amazing. Amazing. Well, so as I understand the format that you are working on, right from your, the assessment that you're taking, or later how you are providing that customized approach towards training. So, is it also applicable on a global scenario? Sorry, on a global, like, could it be also applied for people not from India, but from other parts of the world? So, could it be done that way?
Absolutely. Absolutely. See, soft skills or these behavior skills are required in healthcare across the globe. It's
Mm,
universal, right? It's not
mm,
specific
mm,
to India.
mm,
So,
mm.
whether it is India, Middle East, Europe, anywhere across the globe, you need empathy, you need communication, you need problem solving, you need to have that right amount of spirit to be able to handle patients across any area, teamwork. It is definitely applicable across the globe. Our assessments are on online platform based, so can be taken anywhere in the globe, and whichever way the organization want to approach, whether they want to go by competency based training, a
Hmm.
behavior assessment, patient experience improvement, uh,
Right.
health caregivers. So for caregivers, basically, because it's a lot for the caregiver also, right? The nurses probably are more stressed today because you're dealing with
Absolutely.
so many such scenarios. So how do we customize it? It completely based on the requirement of the organization, and yes, it is purely deliverable across the globe.
So Rashmi, it has been wonderful talking with you today. We are almost at the concluding part of our conversation. Just that I was wondering if you would like to share if how organizations or institutions or hospitals could connect and work with you, because I feel like for hospitals there are kind of teams who would definitely need this kind of trainings, or institutions. I always feel for students. I think institution is a hub of students, and I think the
Yes.
future is with them. I think it's more important to train the present generation, because that's what that legacy they will be carrying forward.
Yes.
That's how things are always. So would you like to share some details where people can actually connect to you, where and how they can connect, and if you can brief a bit about what would be that working model when you are working particularly with institutions or hospitals per se? Yeah.
Sure. So definitely, we are very easy to reach out. You can visit our website www.beyondgurukul.com, or connect with me through LinkedIn or whichever. Just drop us an email or give us a call. That's the first step. And based on your requirement, we will schedule a meeting where we can discuss about your requirement. How do we provide our service? Build that first level of confidence, and then take it forward as how the relationship need to progress. For it's again, the USP is that we can customize. We don't really tell you that this is what you need to do. We first understand what you need, and based on that we will curate program or a engagement with you. So very easy to reach out. And what we definitely want to call out there is starting at a student level, like you said, Kargi, is very important. They still have the learning mindset.
Absolutely,
In a
students are very adaptive and they're
Exactly.
very flexible. And
Yes.
I think the young generation right now, whatever we call them, they're alpha beta, I don't know about that, but I think I personally connect to them very much because it's fun working with them and they're very, very open to new ideas. That is something which always attracts me to, work with
Yes.
students. Yeah,
Yes.
yeah. Sorry, I just interrupted. Yeah, please go ahead.
No, no, that's fine. So,
Yeah.
like you said, they're very moldable. They're
Hmm.
open, but they need to see how it benefits. What is the
Absolutely.
tangible benefit? I think they need logic in some extent,
Yeah.
though they might not feel
Not
very
like
logical.
us. They are smarter. They are smarter than us.
Yeah, of course, every version comes, evolution. It's still happening. So
Absolutely. Yeah.
so if we address these things at an earlier phase, it
Hmm.
becomes part of their life. It's not something
Absolutely.
additionally you're bringing to someone who's already
Hmm.
working for 10 years, 20 years. Changing them, it's not impossible, but it's much easier when you start it at a ground root level. Like, make it part of your curriculum, make it
Correct.
part of your delivery sessions. It should be a thing that becomes a habit for them.
Yes.
It's their second nature, and that's what we
Absolutely.
need to look at, and that's how we should address this gaps that we see in different areas.
Thank you, Rashmi. It was wonderful talking to you. Any last message that you would like to pass on through this episode?
Thank you, Gagi. This has been a fantastic, opportunity, and I have been longing to talk about this for a long time. And giving us this platform to speak about what we do and how we can make a difference. Our intention is to make, sure that people are aware about themselves. That's a very
Yes.
simple intention. And
Mhm.
today's day and era, we are so blessed that we have opportunities to change, pivot our career very well. So instead of going into way that, okay, I'm struggling, or I don't have the right means, or I don't know what I really want to do, approach us. We will help you. And don't take anything. Don't get into a phase where you feel that you have nobody, or your mental health is important. And mental health is sorted when you kind of know that you have somebody to fall back on. So it's not only just about training and career guidance, it's about helping people and telling them that you're not alone. Just reach out to us, and we will do in all our capacity to guide you in the best possible direction. So it is possible today, especially today. We have so much going on in this world, and we can definitely make a difference. So, thank you once again for this fantastic opportunity. Lovely speaking to you, and I hope the audience benefited from what we discussed today.
Yeah, definitely. I think it was a fantastic session, and the kind of things that you brought up, it actually gave me a lot of. I learned a lot from whatever you shared, and I think I had honestly. I mean, I'm very straight on my podcast. That's why the different news is known as. So I honestly myself had a lot of what to say skepticism about soft skill because that's again from my personal experience, but the way you are doing it, I think that is very logical because even for me today, if I want to understand where I stand, whatever I am doing, so what are the points I need to learn and relearn. So
Yes.
that clarity is very, very important. And I think sky is your limit, and I wish you all the best. And I'm sure Beyond Gurukul would be a go-to name for every student, every hospital, healthcare, or I think you apply to every people's life that way. But just that I'm from the field, so I talk more on that. So thank you, Rashmi, once again. It was fantastic, and I think we will have more conversations in the near future. Thank you. Thank
Thank
you,
you, guys.
everybody. Yeah, thank you, everybody, for joining. And I think this episode was useful. So whatever after the session ends, after the live ends, you can find all the details and if, of Rashmi and Beyond Gurukul. If you want to reach out, want to take the assessment, well, I'm going to take it for sure. And so she's all yours. Thank you. Thank you, everybody. Thank you so much.